Hello, Dr. Patrick Price here, and I'd like to show you a little bit about kinesiology. Today, Applied Kinetic Science is one of the new kinesiologies we have on the market. And so this is one I've developed after years of training with other kinesiology people. And so I'd like to show you a little bit about calibration of the patient. And this how is you begin your kinesiology to make sure it's accurate. If you do not do calibration, you don't know how accurate your kinesiology will be. So today, we're going to take some known toxins, which are artificial sweeteners, and we're going to test to see how she is as far as she's calibrated or not. And stevia is always a good sugar to use to make sure someone responds to it correctly or not. The old days you use a cigarette, which is tobacco, and you use an apple. So we're going to take an arm, make sure she has a healthy shoulder, and slowly push and have her look forward for us, and make sure it locks. It locks, right? Then we're going to use the point in the head, positive and negative, and see if she goes down or not. She should weaken even without even touching. So already that she's on. Now using stevia, she should be strong. As soon as I put a toxin in front of her, she should weaken. I just see how simple it is. Doesn't even have to touch the body, because remember, you have a field, an aura, a biofield around the body. So as soon as, hold this strong, a toxin enters the field, she weakens. So you can look at even farther away, now she locks. But entering her field, she weakens. Good old toxins. So now she's calibrated already for our kinesiology work. So I know when I ask the basic question, she is on. Okay? But let's see if we can ask another question. And that would be how her meridian runs. The conception vessel runs all the way up to the bottom of the lip right here. And the direction goes upward. So while we test the muscle and I comb upwards, she should stay strong. But if I erase the meridian, just racing down, she should weaken easily. Everybody see that again? Strengthen if it's going directly up, and down it weakens. These work all with the meridians on the body as well. But the conception vessel is very easy because it goes from the bottom to the peritoneum area all the way up to the bottom of the lip right here. So now, another test. As she's looking forward, as she locks the shoulder, I'm going to give a little bit of a tug and she should weaken. Okay? It locks again. With a little tug, it should weaken. Okay? And correctly, if she looks up and stares at the light, okay, that should weaken someone. Because remember, bright light overstimulates your adrenal glands. If somebody looks up into a bright light and did not weaken, that means they're not correctly calibrated. So this is calibration of the patient, and like I said, she is already calibrated, so now we see that her reflexes will give us accurate readings. And that's what I wanted to show you today in Applied Kinetic Science is calibration of your patient. And I'm Dr. Patrick Price.